Friends, it's Sheree here, and welcome back to another episode of Classes in Session. So today we're talking about the BOVIE. This is the electrosurgical pencil, and this is what we use to cut tissue and to control the bleeding during surgery. So this is what your surgeon's using. That's what it looks like. For baby surgical techs, this is what you're going to be passing off to your nurses. This is what your surgical tech is going to be handing off to you for you to plug into the machine. So let's talk a little bit about the pencil, right? This pencil has tip, is what uses to cut stuff and to stop bleeders. And usually they come in a few different sizes. They come in a few different lengths. So depending on what you're doing, you might see something a little bit smaller, which is like a micro Colorado, which gets used for cases like a facelift, eye stuff. And then we also have longer ones for if we're deeper in the body. That's the tip of the pencil. Here we have two buttons. Now these are the main functions. We have this top button, we have usually the cut option, and then we have the back button here, which is the coagulation button. So cut and coag, two buttons, that's really all it is. In order for this to work, we also put a grounding pad on a patient, and so that's how the current passes through. Some of these look different. We have a few of them that are smoke evacuators, which are really helpful for certain cases where there's going to be a lot of smoke. It's like breast reductions, like we're using the BOVIE on like high heat, and it helps to just kind of suction all that smoke. So it's called plume. As a surgical tech, when it comes on to a BOVIE, we don't use the BOVIE. That's not our job. It's not part of our job to do any type of cutting with the BOVIE, but a surgeon may ask you to buzz them. And that simply means that sometimes the patient has a bleeder, and especially in cases where it's just you and the surgeon's going to need your help. And so he might have a bleeder and he will tell you, okay, can you buzz me? And I remember I don't think I learned this in school. I was just in a case and the surgeon was like, can you buzz me? And I was like, what does that mean? What do you mean buzz you? So I'm telling you guys, if you guys have not learned this in school yet, surgeon's going to go ahead, take a clamp or a AdSense, Fakey, and he's going to go ahead, bleeder. He's going to hold on to it, and then he's going to tell you to buzz him. Now, when he says to buzz him, you always want to wait until you get the go ahead from the surgeon before doing anything. You're going to press the coag button. You're going to go in, and you're just going to tap the back of that instrument, and you're going to hold, pay attention to the field, see if the bleeding is stopping, and you're also going to listen out for the surgeon to tell you when to stop. That's very important. So make sure you're paying attention. He's going to tell you, okay, stop, you stop. Sometimes the surgeon will tell you, come in hot. That simply just means you press the coag button before you get to the instrument. So you're going to hear the BOVIE machine going off, and so you're pressing it before you get to the instrument. So you press, and he said, okay, come on in. You go ahead, hit the back of the instrument, bleeder taken care of. And that's really it. That's really all you do with a BOVIE. Now, when you're in a case and the surgeon is BOVIE and he puts the BOVIE towards you, that means he wants you to clean it. So just go ahead, clean that off for him. Sometimes we have scratch pads on the field that they'll go ahead and scratch to clean the tip of the BOVIE so that it works. You always want to keep that clean. So whenever your surgeon's BOVIE and he puts it back in the pocket, this is our little holster. I always recommend using a holster with your BOVIE. Some surgeons like it, some surgeons don't. Personally, I think you should have it because there might be situations where a patient can get burned because the BOVIE is just laying on top of the patient. Someone leans on it, and next thing you know, it's burning through the drapes, burning through your patient. So safety first, make sure it's always in the BOVIE holster. This is what they make it for, and you're paying attention to the BOVIE at all times. So that's it for today's lesson. I'll see you guys in the next one. Bye.